Dear friends, welcome to Dental Education Hub YouTube channel. I hope you are doing well. Today we are going to discuss a new topic, that is salivary gland stones. So what we are going to discuss in this session, we will discuss introductory concepts related to salivary gland stones. We will discuss the incidence of salivary gland stones in different glands. We will discuss the signs and symptoms that are associated with the salivary gland stones, and we will discuss the diagnosis and treatment of the salivary gland stones. And at the end, we will discuss the other causes of salivary gland obstruction. So, watch this lecture till the end, and don't forget to give your feedback. The stone formation, it occur in numerous organs of the body like kidney and the gallbladder stones. Similarly, the stone formation, it also occurs within the salivary gland, and the salivary stones, they are also known as salivary calculi or sialoliths. Stones may form either within the ducts, the intercalated ducts, for example, or the striated ducts, or it occurs in the excretory duct. Mostly, the salivary gland stones, they form in the excretory duct. So these stones, they cause obstruction within the ductal lumen, and it causes obstruction. As a result, it causes obstruction in the flow of the saliva. The stones, they are usually unilateral. It means they occur if they occur in the parotid gland, it may occur in one of the parotid gland. So, or if the submandibular, it occur in only one submandibular gland. So it is very rare that both of the submandibular gland or parotid gland, they are affected with the salivary gland stones. However, sometimes multiple stones are present either in both of the glands, or multiple stones in a single gland are also present. Now, the incidence of the salivary gland stones. So most of the salivary gland stones, they occur in the submandibular gland, and around 85% of the stones, they occur in the submandibular gland, maybe because of the anatomy of the gland, or the anatomy of the duct, that results in more occurrence of the stones in the submandibular gland. The parotid gland, only 10% of the stones, they occur in the parotid gland, and the sublingual gland, only 5% of the stones, they occur in the sublingual gland. And in the minor salivary gland, it is very rare that the salivary gland stones, they form. So what are the signs and symptoms that on the basis of which you can diagnose that uh, this patient or this person has salivary gland stones? Usually there is pain and swelling, usually in the submandibular gland, and this swelling is only at meal times, or the swelling, it increases at meal time because of the increased formation or and the flow of saliva. And usually this swelling is unilateral. So there is tenderness to palpation of the submandibular gland, because that is the most common site of formation of the stones. There is enlargement of the cervical lymph nodes. There's reduced flow of saliva from the affected gland, or sometimes there is a purulent or pus discharge from the duct. And the most common duct is the submandibular duct, that is called Wharton's duct. Sometimes, if the stone, it is present superficially within the near the orifice or near the opening of the duct, it is easily palpable. There are some common symptoms such as fever and malaise. Malaise means it is the generalized state of weakness. Now, how to diagnose salivary gland stones? So, history and the signs and symptoms, they are important. For example, if a patient is reporting salivary gland swelling at meal times, it indicates that there is an obstruction is there. So it may help you. The history, it may help you in the diagnosis. So sometimes If the stone it is present near the orifice of the excretory duct, whether it is a submandibular duct or a parotid duct, it is easily palpable. Radiographs, they are used for the detection of the salivary gland stones, especially if they have sufficient mineral quantity within the stone. So they are radio opaque and they can be easily detected. And the radiographs they are used are occlusal. And the submandibular salivary stones, they are easily detected on a occlusal radiograph. Sometimes they are accidentally detected on a periapical or a panoramic radiograph as well. So ultrasound examination, it is also sometimes it is performed if it is available. And in three-dimensional CT imaging, it also help in the detection of the salivary gland stone. But later, these two methodologies, the ultrasound and the three-dimensional CT imaging, it is not very commonly available. Now, what are the treatment options that are available for treatment of these salivary gland stones? So, there is milking of the gland, especially milking of the salivary gland duct with or without silagogues. Silagogues are the drugs that increase the salivary flow rate. After the removal of the stone, there is the irrigation is also performed. Other method that is used is intraoral surgical exposure of the stone and followed and its removal. So it is only performed if it is the stone is in the excretory duct, especially near the opening of the excretory duct. Um, there is an endoscopic method that is known as the Sialolith, and at the end of the endoscope, there is a basket. So that basket is used to retrieve or to remove the stone. Similarly, with the shallow endoscope, sometimes there is a laser together with the shallow endoscope, and that laser it breaks the stone into smaller pieces, and later it is removed with the help of the basket. Sometimes, if the salivary gland is damaged because of the stone, or it is present in a location where the surgical or any other intervention cannot be performed, so sometimes the salivary gland it is removed. So the complication and the most common complication it occur because of the reduction of the salivary flow uh, within the affected gland, because it results in the ascending infection in the gland, most commonly the bacterial infection. And that bacterial infection cause chronic salivaritis, meaning chronic inflammation of the salivary gland. Now, the salivary gland obstruction is not always because of the stones. Sometimes it occur because of some other reasons. For example, it occur because of stricture formation, and stricture within the duct it formed because of chronic trauma, and fibrosis because of ill-fitting denture or trauma. Sometimes the inflammatory exudate or pus, it also causes obstruction within the salivary gland. And sometimes the fibrosis or the cancer, it also causes obstruction within the salivary gland. So these are some of the causes other than the salivary gland stone that cause obstruction within the salivary flow. So thank you very much for listening to this short lecture, short but comprehensive lecture. So please do give me your feedback in the comments and stay blessed.